My name is Marisela Charles, and I have been a registered nurse now for 10 years. Okay. I work at Jackson Memorial Hospital, and I also work per diem at North Shore Medical Center. Right now, currently, I'm a graduate student, receiving my master's in as an acute care nurse practitioner. As you can see, my lab coat on the screen. So currently, I am a student. I graduate, God's willing, in 8 months, um, and soon to be a nurse practitioner. Okay. The topic of today, we were talking about COVID-19. As we are aware, and it's been, everybody should know what COVID-19 is. It's in the news, it's everywhere, it's what we're living currently right now. What is COVID-19? Pretty much is a severe acute respiratory syndrome, okay? It's an acute respiratory illness that it was discovered in Wuhan in China. I want to give you guys a little insight, a COVID 3D dimensional view of what does the virus does to your lungs. Because see, most people think like, oh, I'm young, I'm healthy, it doesn't do anything to me. But once you watch this video, and as I go forward with my presentation, I want you guys to really think about, what, have a different mindset after this presentation, what COVID-19 means to you, and what can we do as a community to really stop the progression of how this virus is really going forward, is affecting everybody, internally, community-wise, our families are tearing apart. So I just hope you guys kind of like take a moment to take an insight of my presentation. I'm gonna play like a 2-minute video or less than that, a 3-dimensional view of what the COVID-19 is.
See it front to back, side to side.
It's a first of its kind view inside the lungs of a patient with COVID-19.
This patient is a gentleman in his late 50s who initially had a fever and a non-productive cough like many other people.
A patient at George Washington University Hospital in the district.
Respiratory symptoms progressed quite rapidly to the point where he did need to be intubated and put on the ventilator.
And this is a virtual reality 360-degree rendering that shows exactly what the virus does to the human body.
So what you're seeing in the video, essentially the blue part is the more normal lung, but anything that you're seeing is yellow is lung that is being destroyed by the virus.
Dr. Keith Mortman is the chief of thoracic surgery at GW Hospital. And in partnership with a company called Surgical Theater, he used a coronavirus patient's CAT scan to create this interactive model.
It's quite alarming to see, in all honesty, because unlike your garden variety pneumonia that might affect only one small part of the lung, or unlike the common flu, what you're seeing in this video is really the widespread diffuse damage to the lung.
Mortman's hope is that the technology can help medical professionals on the front lines. But he also wants members of the public to see these images for themselves.
It's really to educate them.
Because he says this perspective should open everyone's eyes to the dangers of COVID-19.
I really want them to be able to see this and understand the damage that's being done to the lungs, the severity of the disease that this is causing. So perhaps maybe they think twice before having a house party or going outside with large groups.
Okay. So this is an internal view of what this virus is doing inside of our lungs. It's really attacking your lungs. That's what it is. And also eradicates other issues in the body, but that's what it is. It affects your lungs.
See it front to back.
Sorry.
See it front.
On the chest x-ray, when the patient's coming in the hospital, the first thing the patients come in, oh, I can't breathe, shortness of breath. And the first thing we do is we do a chest x-ray on you. The lungs are supposed to be, where you see black, it's supposed to be black. A normal lung is supposed to be, you see black space. When you see whitish or opacity, which means that the lungs is full. When you see a whole bunch of white stuff around the lungs, that means that the lungs is inflamed. And it's full of fluids and it's actually attacking itself. A normal lung should never looks like this. It should be all black on both sides. But what you see is that the lungs are inflamed, and then the alveoli pretty much is like a sac where it allows you to breathe in and out, and there's our little sacs. So what happens is when the virus goes into the lungs, it eradicates, it attacks. and your lungs is closing, and the virus is attacking, and lungs are just inflamed. So that's what an image looks like when a patient has a COVID-19. They will classically diagnose you as a pneumonia. So this is a typical pneumonia that you will see in the lungs and the chest x-ray. How does COVID-19 is transmitted? As we know, this is direct person to person, okay? Close range contact, mainly via respiratory droplets. That means if me and you are having a conversation face to face without a mask, you cannot see him, like physically the droplets that's coming from my mouth to your mouth or to your nose, but microscopically you can see little droplets of your saliva going to somebody's either nose to somebody's mouth, okay? Touching on surfaces that are heavily contaminated with mucous members from the mouth, from the eyes, to the nose. That means that, if you're going somewhere, like opening the door, touching stuff at the store, touching register, whatever, those are hard surfaces. You don't know if it's clean or not. One thing I just wanted to share also is that I see most people wear gloves. What's the purpose of wearing a glove? If you're touching, whatever you're touching to yourself as well. So it's like you're cross-contaminating everything. So the best thing is, washing your hands. Wearing your glove is you touching every surfaces, you're touching your phone, you're touching your face, you're touching everything. And then what? You're contaminating yourself and contaminating everybody else that's touching the same thing. So it's just a fruitful advice that it's not best to wear the gloves. Also avoiding the large crowds, a gathering of like more than 2 or 3 people, we can get it. Most people think like, oh, well, it's only 2 or 3 people. No, I'm going to give you an example. I have a coworker that didn't even know she had it, and she was in the prayer service, just 3 of them in the household. It was only 3, nobody showed any symptoms, but then what? In 3 days, all of them got sick. So this virus doesn't have an eye, doesn't have a name, doesn't have an age to it. So we really have to be mindful and really be conscious of when we step out and where to, just being very conscious in what we do. Some of the symptoms may appear between 2 to 14 days after exposure to the virus. Some of the symptoms could be mild to severe. So you may have a dry cough. You may have shortness of breath or difficulty breathing. You can also be fatigued, have muscle or body aches. Most people may have experience of a headache, loss of taste or smell, sore throat, congestion or runny nose. Some of them also may have a nausea or vomiting, diarrhea, some type of confusion, right? So most people think like, oh, my mom, or I was confused, and most people think, oh, it's a stroke. But when you really do the whole test, it was nothing. It was just the actual virus that attacked you in a different format. Of course, the fevers or the chills, and most of them come in with chest pain. So you would think that the patient's having a heart attack, so you do all these tests, and really it's not cardiac issue, it's the actual virus is attacking you. Treatment guidelines. So the risk factors, meaning who can get this virus, right? In the beginning, they said that, those who are in a vulnerable population or elderly, greater than 65 or equal, but now it doesn't include, it's not excluding only the older people. Everybody can get it. Young populations and the pediatrics, right? However, the children, they said that, they can get it, but they may either show little to none symptoms, but those are the ones that you have to be careful, because the ones that are asymptomatic or the ones that don't show no symptoms are the ones that are the carriers and transmit it to your grandparents, your mom, dad, and those who are actually sick. So this virus is really, it affects those highly, or classified highly, on those who already have heart disease. If you're diabetic, if you're obese, if you already have a transplant, meaning one of your organs, you have a transplant organ, you're already, like, your immune systems are already, like, you're very already on the vulnerable side. Your immune system's already weak. If you already have like an autoimmune disease, like you sickle cell, rheumatoid arthritis, lupus, if you're asthmatic, if you have COPD, lung cancer, and if you're a smoker. These are people, populations of people that can really, the virus can really affect you if you fit in this category. Yet you can also be a young person and healthy, and it can also affect you as well. Some of the mild symptoms, again, we're classifying as mild, which means fever, malaise, meaning like your body's very body ache, tired. Okay, you have cough, headache, sore throat, nasal congestion, diarrhea. At this point, when you're admitted to the hospital, they classify you as, where do you fit? Do you fit in a mild, moderate, or severe category? A lot of people rush to the hospital. Oh, I got COVID. I think I got COVID. And then the ER is fluctuated with patients. What does that mean? That means that we cannot admit everybody that has COVID. Why? Because the hospital needs to have a certain percentage of open beds for emergencies, okay, and non-emergency situations. So that means that if you fit in the mild symptoms, meaning you just have a fever and you feeling congestion, diarrhea, they say, okay, we're not going to prescribe you no medication. We're not going to prescribe you medication. Use only supportive care, meaning, hydration, take Tylenol. That's kind of like on the mild symptoms, and you can go home. But going home means quarantine yourself for 14 days. Sorry, yeah. Quarantine yourself for 14 days. You guys can see me? Or can see the presentation? I'm sorry.
Yes, I can see it.
Oh, okay, because I kind of had to change the little gallery. So, which means that only supportive care. That means you go home, you quarantine for 14 days. 14 days, that means you isolate yourself. That doesn't mean you go out in the community and you do gatherings, right? No. 14 days at home. Isolate yourself, okay? Moderate symptoms mean any symptoms of a mild disease and your oxygenation, SpO2 less than 93% on room air. So for instance, if you come in the hospital and you have some of the mild symptoms and you can't breathe, you have shortness of breath, we put you on a little meter and say, okay, her oxygenation is at 93% on basic room air. That's the room air is what you're breathing right now. There's no supplemental oxygen. However, within an hour, we say, okay, she's going down. She's still going down. Let's do a chest x-ray. The chest x-rays that I just showed you guys, and it matches what you were displaying physically, you can't breathe. This is when we actually require you to be hospitalized, right? So if you just have mild symptoms and doctor say, okay, just quarantine for 14 days, you go home. However, what requires you to be hospitalized when your oxygenation falls below 93% on basic room air and the symptoms that you already displayed, okay? So on the chest x-ray, it says it will show as bilateral glass opacity or bilateral consolidations. It's a form of pneumonia, which at this time, they will diagnose you as a type of pneumonia. These medications that they give you is dexamethasone, which is a steroid to allow some of the inflammations to reduce some of the inflammation from your lungs, okay? Then they also prescribe you on an anticoagulation therapy, which is a blood thinner. If you've never been hospitalized or you've been hospitalized, you may or may have not been given this medication, but it's a blood thinner to prevent a blood clot. This virus is very aggressive, and as far as what we've been doing this for, like, Corona been here about 4 or 5, 6 months now, maybe. And they're still having studies, they're still doing research, they're trying to see how does this virus, it changes, on the weekly basis. So they have noticed that some of these patients come to the hospital with chest pain, and you have a pulmonary embolism, meaning you have a thrombus, you have a clot in your heart, you have a clot in your lung. And so this is what the virus does. It can cause you to have a blood clot. So they say, okay, let's just start putting the patient on a heparin drip or a Lovenox injection to prevent for them to have a blood clot. Another medication they have also studied was called the remdesivir, which is a antiviral medication, which is a medication, to help to kind of like slow the virus down, in the body, kind of slow down the virus attacking the body, and also to get to like a recovery stage, you know? So again, there's not a pinpoint what medication works. There's still a lot of studies out there. There's still a lot of, you know, they're still trying to define, you know, what works, what medications, you know, they're trying to like compare one medication to another. On the severe symptoms, this is the part where like, you know what, we already tried all the medications. You know, right now the patients, we trying to, you know, they can't breathe. We gave them regular oxygen through the nasal. We'll put them on a non-rebreather, and we put a high flow of oxygenation. This is not working. The patient still can't breathe. And so then at this point, they say, you know what? This patient's already going to respiratory failure. And this is the point where they have to put them on an intubator. Okay, this is the ventilator. This is the mechanical ventilator, which is a machine that is pretty much is breathing for you. Okay, at this point, this is severe. What are the chances that you're gonna survive? Who knows? Is you have people that survive from a ventilator, but this is your last step before death. Okay, what falls you under the categories of severe symptom is, again, if you have your chest x-ray looks worse than what the image that I show you. Again, your lungs are attacking your cells. Your body is fighting itself, like it's attacking. The good cell, the bad cell is eradicating aggressively. This is the last, they give a drug therapy called the convalescent plasma, which means an immune plasma or a hyperimmune plasma, which means that if those who already survived from this COVID, you develop like an antibody, right? So it's like, okay, you know, if I got infected and I recover fine, you can get my blood, my plasma, my cells, and say somebody who's actually active with the virus, we're going to intravenously put it into their body and to see, okay, let's hope that this medicine will help, you know, attack the virus that's attacking them right now, to slow it down, and hopefully this will work so their body can say, okay, back to normal. But again, is it a 100% cure? We don't know yet, because it depends on your immune system, your defense system of your own body. Okay, so tips to slow down the spread. Currently, there's no cure, there's no vaccine to prevent the COVID. You know, there's still some, you know, some statistics out there that's still trying to do a trial and error if the vaccine really works, but we don't have an official, you know, medication or vaccine right now to cure to slow down this virus. Okay, the best way to prevent the illness is to avoid being exposed to this virus. So that means you must wear a mask or face covering at all times when in a public area, especially in an area that is closed and confined. That means that even if you're going to a family gathering, unless these people do not live in your household, even if you're going to cousin's house, even if you're going to auntie's house, protect yourself and those loved ones that you're going to visit. Again, this virus doesn't have any eyes, it has no name or age. Everybody is not exempted. Everybody can get this virus, okay? Maintain 6 feet at all times, even if you have a mask. That means that, you know, it depends on what type of mask you have. But the average mask that most people are wearing is, they call it like a level 1 barrier mask. It's the regular thin mask, right? They don't want people to go to the store and you know, and get the actual healthcare mask, because of course we're actually in the hospital and we actually physically need it when we have to really, you know, expose ourselves to those who are already infected. So a basic mask or face covering is okay, but you don't know when you talk if that particles of when you talk will actually reach over to the next person. So that's what they say, maintain 6 feet at all time. Constantly hand hygiene, hand sanitizer, wash your hands at least for 20 seconds or more. So the mental state. Me working in a COVID, I work with COVID patients, and I've been doing it for now since March. The inside of this is that, unfortunately, you know, they don't allow no visitors. So patients and family members are very anxiety. Why is there like a line on here? Oh, I'm sorry.
It wasn't you. Somebody did that by mistake.
Oh, okay.
Yeah.
Well, Okay. Why is there a line on here? Is it me?
No, it's not. No.
Somebody's writing on here.
Yeah, they don't realize that they're doing it.
Okay. Well, again, so wait. Oh, they're gonna mess up my presentation. Okay. Okay, so I'm sorry. So again, like at this point, the mental state, and these patients are experiencing, depression. I have patients that want to commit suicide. We always have to get a consult for the psychiatrist or psychologist to be on board, because these patients are, they're in a room and, they can't come out. No visitors can come see them. The only thing is if you have a phone, and if you can do iPhone, you can do like FaceTime. But family members are, outside, bringing their loved ones in the hospital, and they think like, oh my God, my mom or my dad or my loved one may not come out. Or you get that phone call from the physician and to give you that bad news. So at this point, like, this virus is really affecting loved ones, and these patients become depressed. They feel helpless, neglected, isolated. Most people are experiencing unemployment, loss of a family member, those who are close. So this is really, a time of reflection to really, let's not play games and take it a joke. Let's just actually take it seriously, you guys. And talk to your loved ones and friends and family to take this seriously, because you don't know if tomorrow is promised to you. You don't know, if you get this virus is how it's going to affect you. Some people are fine and walk away like nothing happened, and others don't make it. I personally have a coworker that, she was wearing her face mask, but then again, it's like, wow, where did I actually get this virus? I thought I was protecting myself, but you just don't know. So I have a friend that she passed out, had chest pain, and they called the rescue on her, and she said, no, I don't want to go to the hospital. I may not make it out to the hospital. I have another patient that pretty much was in drug overdose. She suffered from drug abuse. She suffered from drug abuse. She relapsed and drug abuse, cocaine, and everything. And was one day her husband they went overdose on cocaine, and the tenant or the actual manager, I guess they were living in a halfway house or one of those shelters where someone was always, checking on them. And then they get one of the tenant or the manager didn't hear from them. Didn't hear from them. He actually knocked the door out and saw both of them passed out. The wife made it, the husband didn't. So this is just to say that people are really depressed, and we really need to really consider and really have a time of reflection. Okay. What else? COVID-19 testing. You are, like I said, when do you get tested? You should get tested when you're exposed or have been exposed to someone who has been ill with the virus. Even if you don't have symptoms, if you've been around somebody or possibly been somebody with or without symptoms, you need to get tested. Protect you and your family and everybody around you. Do not keep it a secret. People walk around, don't telling nobody, oh, I got the COVID, but I don't want nobody to know. No, you need to speak out and get tested, and everybody around you need to get tested. There's another test, the testing, it can be done nasally, and it's also can be done as a blood work, which is like an antibody testing, which shows that, if you've been infected or if you are infected or have been infected. So it's like an immunoglobulin. So it's like your immune system. They're testing to see if you have the antibodies. So it's called IgM, which is if you're currently infected, and the IgG, which is post-infection. But that doesn't mean you get your blood test today. Say, for instance, is that accurate? It's a 50-50. It's not an actual percentage yet. But, most people go get tested and, for example, I got tested and I'm negative. Does that mean you may not be positive? You could be positive in the next 7 days. So, the test to me, I personally have experienced patients, they come in and it says negative. In 7 days, we do another test and they became positive. So you don't really know when this actual virus have really attacked you or when it creeped up in your system. So they say incubation period between 2 to 14 days. So that's like a window saying, hey, I think I've been exposed today. So I think I need to, get tested. You should get tested. But then if you don't feel accurate about it, you could get tested in the next 7 days. So the antibody testing is just pretty much saying like, which tests come, before, if the nasal swab didn't come in on time, let's just do a blood work to see if you've really been infected, if you still have the virus sitting in your system. Of course, where can you get tested? In the local communities, urgent cares, they do on these mobile drives. So just Google it up and get tested if you need to be tested. And this concludes my presentation. Any questions? And my sources come from, of course, there's an appendix treatment guidelines that I follow. I'm actually doing my clinicals at Jackson. I work hand in hand with the infection disease doctor, where we actually look at COVID cases all day and every day. And it's very surprising, like the type of patients that are coming in. I even had a woman who just had a baby and was positive with COVID. And right now, I hope she doesn't have to have an intubator, but she wasn't looking good according to like the charts and everything. So, and like I said, you can always look it up in CDC guidelines. Go to cdc.gov and you can get more information about COVID. And then there's another website called Up to Date where these are clinical resources that I get my information, that are researchers and scientists that put information to the system to kind of, update you what COVID is, the treatment, the guidelines, and that's it. And that concludes my presentation.
Marisela, we have a person with Tyrone Cobb's line who has a question.
Yes, I have a question. Can you hear me?
Yes.
Me?
Oh, yeah. I wasn't sure that I had it on unmuted. Is it unmuted?
Yes, ma'am, we can hear you.
Okay, thank you. I want to know about your hair, or inside your hair, or can it travel in your hair? Say like you have your hair out and you out talking,
Mm-hmm.
and can the virus get in your hair? And
so I don't know if it gets in your hair, but I to be honest with you, when I go to work, I cover from head to toe.
Mm-hmm.
So to me, they say it's droplet. To me personally, I think it's airborne. They say droplet because it's like me and you talking, and then you see the saliva particles. I feel like it's in the air. That's just my, so I don't know if it actually you can get it from the hair.
Well, but, you know what I mean? Somebody tall talking to you and the droplets get in your hair.
Uh-huh.
Would it last, like they say, on a surface?
They say on metal surfaces, they say live longer. So
okay.
So anything on a metal surface, that's why you have to be careful. Like, that's why you have to constantly wash your hands. But as far as like your hair, I don't know. I don't know if it, but I know
most nurses cover up from head to toe.
Oh yeah, because the thing is, we cover ourselves because you'd be surprised. When I come in the room, technically you're supposed to wear your mask. If you have COVID, you're supposed to cover you're supposed to have a mask, right, to protect me and protect you, right? Mm-hmm. So some patients come in and then you don't know if they're gonna sneeze on you. Mm-hmm. So it's just like, oh shoot, and he's like, oh my goodness, you don't know if it went to your eye, you don't know.
Right. Okay.
The virus, when it travels, I feel like it goes into whatever open hole it is. So I'm just like, let me cover myself from head to toe and constantly washing my hands. Like, I bleach everything. I leave my shoes. I take my clothes off, my uniform, put it in a plastic bag, and I put my shoes outside. Like, I don't know what this virus can potentially do, and how long it sits on the surface. So I just be on a safer side. But I don't know as far as the hair. I don't know.
Okay.
Yeah.
Okay,
I have a
those
question.
persons calling by phone, excuse me 1 second. For those persons that are by phone, you could press *6 to unmute yourselves and *9 to raise your hand if you have any questions. *6 to unmute and mute yourself and *9 to raise your hand if you have any questions if you're calling in by phone. Also, the chat box is available in the more section. And who
Hi.
had a question? Go ahead.
Oh, I'm sorry. I just want to say real quick, awesome presentation. Sister Marisela, thank you so much. Very informative. This is great. And I just want to mention from what Tyrone, and we thank God, of course, for Elder Ahmad and always bringing forth great presentations and people to speak to our youth. And so it's such a blessing. So I'm so grateful for this and thankful for you all. Truly a blessing. I just want to say with what Tyrone mentioned about the hair, because I did hear too that some people had gotten corona from a little, I guess what you call weaves or lace fronts. That's what it was. And so that's why I'm sure she about to ask it. I know I heard it, that some people literally got corona from lace fronts, and that, you know, people was trying to be cautious when everything first happened, because it was coming from, a lot of lace fronts was coming from China. And some people who are suppliers, some people I know said that they wasn't getting the shipment in because it was on hold, because they had heard that too about some corona getting into some lace fronts. So I just wanted to just piggyback off of what she said, and thank you so much.
Okay, also next we have Maritza who has a question, and then the person whose number ending in 4762, you can go after Maritza.
Good evening, everyone. So I had a question about, in the event that someone in the house, a family member, has COVID-19, everyone got tested, someone tested positive, everyone else tested negative. What is the likelihood that the rest of the family member will get tested positive? Like, do you suggest they get retested after a few days, or that individual who was tested positive, she has to just stay quarantined in her room for 14 days? But, you know, like, how does that work? Like, what do you suggest for that family?
So, like I said, you know, it all depends on the time of exposure. So if you've been around somebody that potentially was positive, again, if you get tested today, you may be negative, but in the 7 days, you may be positive. So it all depends on at what time does the virus travel into your system. That's why they say give a window between 2 to 14 days. 2 to 14 days, because from the time of exposure, by the time it enters your body, it's like a cold. You know, someone got sick in the house, and then in about a week or two, you start getting sick. So you got to treat it like a flu type of thing. So it all depends on at what point did the virus creep into your system. I personally would think that everybody in the house should get tested, get 2 times tested. So from, like, say for instance, if they, you know, been around somebody today and they can get tested, you know, most people would be like, oh, let's wait and see if the symptoms arise. Again, you don't know what the virus may do for you. It may not do nothing. It may walk through your body and in and out, and nothing happens. Or you may have some mild symptoms to moderate symptoms, right? Like, oh, body ache, you wake up and your body hurts, or you may have sore throat, or you may have diarrhea. You need
in this situation that I was asking for suggestion is the individual they don't have any symptoms, but they did test positive, and everyone else in the family tested negative, and they all took the test at the same time.
Right. So I would suggest everybody needs to get retested again to make sure there's accuracy, because sometimes it depends on who does your test. Some people may not do the test properly, and of course it's going to show that it's negative. So I would say to confirm, get 2 tests to confirm it's negative. Again, most people do the blood work. It depends on where you get the test done, because if you go out in the community and you're in a stadium with thousands of people, who knows if your blood, if your swab, wasn't mixed match with somebody else or got lost. So I would say get tested twice, or you can do the blood work. But then again, I don't know too much of it and the cost of it. But again, the blood work only just says, hey, you've been exposed. Either you actually have it or you've been exposed. So I would say to get tested twice. So if you've been negative today, I would say try in about 2 weeks or within 7 to 10 days, get tested again to make sure that, okay, for sure I don't have it. You can't just go person in the hospital positive and everybody's negative.
Okay.
Okay.
Got it. Thank you.
I have something.
There was one person. I'm sorry.
I'm sorry. Go ahead. What? I didn't
There's
see.
a person whose phone number ending in 4762 who had a question. I'm going to unmute them.
I am here.
Go ahead, caller.
Can you hear me?
Yes, we can hear you.
Okay, well, first of all, good evening to everyone. So what I want to do is just piggyback off a couple of things. I have someone that's very close to me, a family member that had COVID or maybe still has it. The ironic thing about it is that she was in quarantine 2 months before she got it. She's very meticulous. Her husband travels all the time, all over. And about 14 days ago, she was diagnosed with COVID. Okay, so yesterday was the first day that she found herself, when she texted me, she was saying how good that she felt, the first in quite some time. So she lost her smell and sense of taste and all, so now she's up walking. Now, here's the irony. Her husband travels all over the country all the time, and she had COVID. Her 2 sons didn't have it, and they still don't have it as of a few days ago. But what they're going to do is test again. What I want to say and encourage is that COVID does not discriminate. And I would never, ever think that, actually, it's my sister, would never, ever have this virus. So it is so important. And the thing about it is that she hadn't been hanging with anyone. They all have been quarantined together. How she got this, we still don't know. It could have been from her giving someone a ride to church or something. As I understand it, I don't know. But let me tell you something. No one has been in my house, and I can't tell you. I don't even tell you how long. I don't visit anyone. I don't want you in my house or whatever. I'm not in crowds, and I basically am in most of the time. And I am a senior, so I am at risk. So I try to do everything I can to look out after myself, because I do plan to be around for, sometimes what God says is my time. So I just want to encourage you that it is absolutely imperative. And my brother is an anesthesiologist, so he's the one that's always giving us updates on, you need to do this and you need to do that. You need to drink the green tea. You should put lemon in it. You must do this. You must do that. Do not stay lying down. You need to walk around and all that, because it'll hit the chest, and so many other things. But no one, so many people don't take this. They don't value this information. And I see people every day that are walking or wherever they are, even in stores, and I run the other way, that they don't have any mask on. So with this lady that I'm speaking of, my sister, you don't know the kind of lady that she is, but I could never think that she would catch it. She's very this way, that way. She is just really something else. But she has it. The family doesn't have it. We don't know where it came from. So since we don't know where it came from, it is so important that we all always protected, no matter if it's with a family member. I don't care who it is or whatever. I'm going to have a mask on. I carry them around with me. So I just wanted to share that, because I'm trying to understand, how is it that she has it, no one else has it, tested again, and going to be tested again. Do you have any insight on basically how this happens with this virus?
So like I say, I'm not a researcher or a doctor, but every time you step out your house, you have a chance of getting it. So even if you go to the grocery store and you maintain
Yes.
6 feet, it's like you really can't even go, to retract yourself. Like, oh, well, I just went to the store and came back. Hey, it doesn't matter. Like you still find the chance of still getting it. So I think
Absolutely.
So I think again, that's why you have to like wash your hands. Like, I mean, I walk around with an alcohol bottle. I walk around with lights.
Same here. Same here. Same. In my purse. In my purse. Yes, ma'am.
I wipe the handle of my door because you don't know, like stuff sitting on your skin, you don't know. So that's why it's important to constantly wash your hands. Like when you come in and out of your house, you should always wipe down again to decrease the chance of if this virus even sitting on any type of surface. So your kitchen counter, the doorknobs, the light switch, constantly cleaning again. And just like I said, every time you come out, you just try to maintain yourself distancing from everybody. So say for instance, I went to Costco. Before they used to have like a certain amount of people. Now I see like it's so crowded in there that when I shop, like when I check out, like I'm like, they say 6 feet, I'm like 12 feet. Like that's how far I am because you just don't know. So always try to shop, as early as possible in the morning if you can.
Exactly.
I'm like the senior.
Exactly.
I like to get up in the crack on the dawn, 6 in the morning, 7 in the morning, and I shop, to avoid a large crowd, So I would just say that like I said, you don't know when she could have got it.
You don't know.
Every time you step out the house, and if you just by your next door neighbor, you just don't know. You just don't know. So
exactly.
Just maintain a precaution, constantly washing your hands.
Well, that's what I'm doing.
Yeah.
And one last thing, I remember like a few years ago when they first started putting out the sanitizer in the stores. I remember going to stores and people laughing at me because I've always sanitized. So when I went to a store, it wasn't very popular, but I was still sanitizing. Now it's amazing. Now everybody is sanitizing, but it's funny how we look at a person a certain way, like they're off or whatever the problem is, that they got an issue. Why is she sanitizing the buddy? Why is she doing this? Because it's what I did. Now everybody wants to sanitize, but I was laughed at. Isn't that funny? But nobody's laughing now.
No, everybody say, "Oh wow, this is serious now."
Oh yes, exactly. Thank you for letting me share my story.
Oh, no problem. You're welcome.
Next we have our sister.
You're very, very informative. Yeah.
Thank you.
And thank you everyone for all of your comments. Sister Chanel Walker, she's next.
Hi, God bless everybody. It's so nice to see you, Sister Marisela. What an awesome presentation.
Thank you.
I just thank you for it. Just to say, like, I have a friend right now who's battling COVID. She and all of her children got it. She says she don't even know how it came in the house. She says she went to the store, they got wet, and she said her and her oldest daughter went to the store, they got wet, and she said all she knows after that she got sick. Like her daughter started having like fevers that wouldn't go down, it kept elevating. So that happened with her. And then, but right now, like she's afraid. And then another part to that is that, and I think it was like December or November, Faith and I got really sick and we couldn't figure out what was going on. We didn't go to the doctor, but we were really sick. Faith fever was really high. And I was like, you still sick? Because it's not normal for us to be sick for so long because it dragged on. But we didn't know about COVID back then in December. So they were saying that they started talking about it in February, March, but they were also saying that it could have been here sooner. So my thing is, if we already had it, and there are new strains like every day, like, new strains coming out of it, what's the risk, do you think, of us contacting it again? Because that's also what my friend is afraid of. She was saying that if they clear up now, when they clear up, she say, what's the odds that we get it again, get a different strain? Because she was like, we don't know what strain we have.
So once you okay, so once you've been infected, it doesn't, again, this virus doesn't discriminate you. You can get it again. Now, the question is, how is it going to affect your body? You know, like, you know, it can pass through your body like nothing, or it can really be more aggressive on you and get worse than the first time around. So it's, again, like, it's true. I think this virus has been sitting here for way before March. I think it's been here like around in the winter. It just, unfortunately, it's just nobody really talked about it until like in March, which was already too late. So I would say that, you know, to really know, except for instance, if you do the blood test, like I was explaining in the presentation, you do an antibody test. An antibody test is going to be like an IgG and an IgM. An IgG, that means that, oh, you currently are infected with this virus. It may be reactive. That if it shows as a reactive, that just say, oh, you're currently infected with this. If they do an IgM, it may be reactive too. That means that you've already been infected. So the question is like, okay, if you've been infected already, you know, you can just do the blood work to say, okay, I had this virus, I already developed an antibody. So is it gonna, you know, can I catch it? Yes, you can still catch it. The question is it gonna, you know, affect you like it did the first time? Sometimes some people may have no symptoms, and the second time around you may have a more moderate to severe symptoms. So I would say don't put your guards down. I would say to continue protecting yourself, even if you've already been exposed or got the virus. You, like I say, it's so fairly new to us. We don't know. Every day, everybody's trying to figure out what this virus is doing to everybody. You know, like you got patients that come in and then you think they came in for a heart attack. And when they did the whole study, oh, when they do the whole, like a whole diagnostic test on them, oh, they were positive of COVID, but nothing else showed. Like, what happened? Or patients come in, you think you know, come in with a headache and you think you have a migraine. And when they did all type of blood work and tests, nothing, but you just had COVID. So it's like, you just don't know how this virus is aggressively attacking you. Again, I will say to not put your guards down and continuously practicing hand hygiene, face masking until we can really figure out, a vaccine or a cure, just like any diseases that the measles, that's why they're so important. Again, there's some people that are anti-vaccine. They don't believe in vaccines, but I believe in vaccine because it protects you from viruses and diseases, like the measles, the mumps, I do the flu vaccine. Some people don't do the flu vaccine. I do it because I work in a healthcare field. I get exposed to a lot of stuff, and I say if I can protect myself or myself and my children, I do it. But again, I would say to continuously protect yourself. Don't have your guards down, that you can get it too. I have a friend right now who's a nurse, and she was developing severe symptoms. I was worried for her because I was like, you may need to get hospitalized. She don't want to go to the hospital. And she's already been tested twice and she's still positive. So, and now she don't have no symptoms, but again, you don't know how long is this virus sitting in your blood. So it's one of those things is take the precaution, practice safe social distancing. You guys, I really want you guys to understand, like, this is serious, and I want you guys to protect yourself and your loved ones. I've seen a lot of family, I see a lot of patients, left and right gone. And, all because, people is being careless. Don't think because, oh, my child can go out and he can get it. Your child can get it, okay? Your child can get it and can transmit it to your loved ones, especially your grandparents and those who are vulnerable, okay? So that's the best way I can just answer you, Sister Chanel.
Another question.
Mm-hmm.
Okay, Ariel has asthma, right? So that's like an underlying condition, even though her asthma isn't severe, but it comes up. It hasn't been in a while. So, and I tell people, like, my fear is, like, you pray over your children, you pray for the best, hope that they be well and everything. But the thing is, if she gets it, like, because it's a respiratory virus, it's like the complications, like, are so great for her. Like, it's like, I don't know how her body will react. And it's just a lot of things. So I've been like getting them vitamins. They don't want to take the vitamins. Nobody in the house takes the vitamins except for me. So, you know, I went and bought everybody their personalized vitamins. I bought little bottles of alcohol, like bottles, and put alcohol in them. They don't use the alcohol. You know, I had to tell them to make sure you get your mask before you go somewhere. You know, try to keep your distance. And then Faith, by her being young, just graduating, she wants to go to parties. I want to go to this party. I want to go to that party. And so I try to tell her, like, you shouldn't be going to all these different parties like that because you don't know who got what or whatever. And then she's like, oh, but it's fine. You know, it's okay. Like, I'm young, blah, blah, blah. You know, she doesn't think that she could catch it.
Oh, so like I said, you know, it's just teaching your kids and really, you know, again, unless you, how to say this, some people are just very careless because if it doesn't affect you as far as if you never had a hand-on experience, meaning a family member that died from COVID, and you have insight, physically see how patients are physically sick. Like, I feel so bad for these patients because, like, they look like, you know, you have 1 foot in and you want 1 foot out. Like, you don't even know if you're going to make it. They look so depleted. I mean, dehydrated. I mean, you give in there and they can't eat, you know. So, you know, people really need to take it seriously because especially our young youth, you know, people doing this pool party and, oh, let's go to this COVID party and woo, 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 let's house party. Again, you don't know, you're not excluded, whether you're young, old, whatever. Even if you have a healthy immune system, you could be a carrier and it can transmit it to somebody else who have a weak system. You know, like when this first started, everybody was like, oh, let's go get to this 1,000 milligrams of vitamin C and then let's go take this green tea and this grape seed and all this. Again, this is all to build your immune system. It doesn't exclude you from not getting it. It just said, okay, let's rebuild my immune system. So if it does attack me, my body is not breaking down and you know, as defeated, you know. So those supplements are there to help and repair your cells. So when you have anything that, remember, your body, whatever doesn't belong, your body is your natural body, and your cells in your body try to like build up like a defenses, like it's on war. So anything that comes in is trying to fight it. Like, hey, you don't belong here. You don't belong here. So that's what the immunity does when you have a strong and an intact immunity, is that it's like it's getting ready for anything to come. It's like your immune system is like a shield. It protects for anything that's not belong there to protect them. But if your immune system is impaired, meaning if you have high blood pressure, if you're obesity, if you're diabetic, if you have any respiratory condition, if you have HIV, your immune system is low. And what it does, anything that doesn't belong there, it affects and attacks your body, and then you don't know what it's gonna do. You know, you don't know. The end of this thing is some people get like severe lung issues, scar tissues in your lungs. So if you already have lung issue, it's like, you don't know. You don't know if you're gonna be, you know, a ventilator is not, most people be like, oh, how long should you be on a ventilator? Like the breathing machine. A ventilator is not meant to be in your body forever. It's there to help you, but your body has to eventually recover and say, okay, back to my own lungs to breathe for itself. But if a machine itself, and you've been on it for 30 days, you're gonna get that a DNR, which is, or a DNI, which is do not resuscitate. And the way it is in the hospital, unfortunately, because of the spacing in the hospital, they're gonna look like this. If I'm 25, for example, I'm not 25, I'm 33, but if I was 25 and somebody who's 90 and have a better chance to survive when it comes to a mechanical ventilator, they're gonna give it to me because I have a longer life to live versus somebody who's 90, who they're like, you know what? They already got too much conditions. We cannot give that ventilator to that. That's how it goes. Unfortunately, that's when they make a decision. That's what they do. So I would say don't take it lightly. I you know, again, we need to educate everybody, our family members, our children, the importance of wearing this mask. again, it's something new for all of us. We're learning day in and day out. So I think we need to just educate and educate our community and those around us, man. I really, it's sad. It's sad because the hospital right now, Jackson, has taken about 7 floors. Okay, 7 floors where it's like it's so bad. It's so bad that it's patients, and they're coming in the ER. They have patients all over the hospital in the hallway. When you go in the ER, you have your own private room. These patients are coming in there in the hallway. There's no rooms because the actual floors are full because patients are sick. So I would just say, Sister Chanel, to actually talk to your children and really understand this virus has no name, no age. Everybody can get it.
We have Sister Audrey, who's next. Thank you, Sister Chanel, for that question and comment. Audrey, you're next.
Okay. Yeah, you can hear me?
Yes.
Everybody say that. I just wanted to share, I guess, my experience with it. I did contract it, and it was from a birthday party. I already know. Like everybody, like most people, I was in the house. I was making sure I was cleaning, and the friend who had a birthday party, she works at a nursing home, so she gets tested, bi-weekly, every 2 weeks. And we've seen each other, so I didn't think anything of it when I was invited to the party. And it was just her family and me and my kids. We went, and like literally when we got back, I noticed my body started just feeling weak. And I developed cold symptoms, and I immediately started taking medicine, cold medicine, but I noticed it was not working because usually when I get a cold from work, because I'm a teacher, I get colds pretty often. So I would just take emergency or just regular cold medicine, and it would stop within the next day. I would notice my body getting better. But with this time, I was like, this is not a regular cold. I think I might have contracted it. And I told my friend who had the party, she still didn't have any symptoms. But then her grandmother, who's like 80, she had started developing fever. She had to actually go to the hospital. I lost my sense of smell and taste. So then I got tested. My kids were physically, they were fine. I had them tested. Sean had to get tested. My God, it just was an eye-opening experience because it's like, okay, I did something I went somewhere thinking, okay, we're just having innocent fun. Just not thinking, everybody there could be a carrier. And I just really, it was an eye-opening experience because even though I was able to heal, it was other people that was there that didn't do as well as me. Even my friend, another friend that was there, she was younger. She was really sick. And it's just an eye-opening experience because, like you said, it does not discriminate. It don't care what it could be wherever you are. And everybody is going to react differently to it. And that's why I'm thankful because I didn't have to go to the hospital. I was able to heal at home. But again, like you said, older people are really higher at risk. And me and my friend, we talked about it. We really felt horrible because we exposed her grandmother to that. And well, I know I didn't have it, but I got it from the party, but somebody there didn't know they had it. And Sister Chanel, Minister Walker, Minister Walker, yeah, I would definitely tell Faith to be careful where she goes because it can be anywhere. And even though you think it's innocent, you just with friends and y'all trying to have fun, you got to really think about where you're going because you put so many people at risk just by going to a party you think it's innocent. And I really, was apologetic to my mom because she contracted it. Like everybody that was around me after the party had to go get tested, and I had to quarantine, and I got to get retested. You got to get tested again twice, I heard, to get 2 negatives. And you can contract it again. It's like a cold and a fever and flu. You can get those again. You can get this again. And I don't want to get it again, especially willingly. I don't want to. So I just wanted to share my testimony experience with dealing with it firsthand. My kids did come back negative too. Everybody else came back negative except from, my mom. She had it, but she's doing fine. She didn't really have any symptoms. She just lost her nose. She said it was very dry, and a little bit of sense of smell, but I lost sense of smell and taste. I did have a fever for a day or two. I was very weak, and I feel much better now. I can notice the difference in my body compared to 2 weeks ago. So yeah, we have to definitely be careful where we go, because you never know. Even if you think it's innocent, it's fine, it's fun. You put so many people at risk when you come back home, or go to your house or a family member house, and they haven't been anywhere, but you go to the party. You come back home, you bring in something home you don't even know you have. So I just wanted to share my experience. That's it.
Well, thank you, Sister Audrey, for really sharing your testimony. And you see how the triple and quadruple effect happened on that. So, even me, as I had my birthday party for my son, and I already planned everything, so I didn't have a big gathering. But I had my mom, my aunt, my husband, and on his side of the family, maybe like 2 or 3 members. And the party already happened. I already put together. I prayed that I'm like, Lord, we're gonna go forth with the party. But in that same time, in the party, I was like, Lord, I just hope I was not being selfish, and that I wanted to have a party for my son, but I just hope that I don't put nobody at risk. People did, my aunt and my mom, those are, we'll say, the most vulnerable ones. How you call it? Actually, wear the mask. But again, it's like I was scared too, because I'm like, oh my God, even though it was outdoor, it was small gathering. But again, it's like you don't want to put nobody at risk, and you don't want to be blamed for if something really drastically happens to someone. So I'm glad. Thank you for sharing your experience.
Yes, Marisela, this is Apostle Sonia. I really appreciate Sister Audrey sharing, and for everyone that's sharing. And also, it's good to see you, Marissa, on, and everyone that's on. But I wanted to say what when you just mentioned about putting people at risk, and so we have not had services, because that's one of the things that's in my heart. Not that I'm a woman of faith. I am definitely a woman of faith, but we don't want to put people at risk, or even allow.
Oh, we lost
You
her.
muted. You muted. We can't hear you.
I muted myself. Sorry about that. We don't want to put people at risk. And I have even heard just recently, Evangelist Butler told me about the story about a pastor that came in her store, and the pastor was saying how some people, they was having church, and that an old member came to the service and was like, pray for me. And the pastor, they all prayed for this old member that came back to the church for prayer. And then the whole church came down with COVID. And so I'm just saying that, and especially now in Miami and the state of Florida, period, but especially certain places in Miami, they're calling it an epic center. And so we really need to pray for our region, for our area. And as you said, make and do due diligence with the mask and all these things. I never got tested, but I got really sick about a couple of weeks ago. And when I got really sick, I was too sick, to be quite honest, to even go for testing. That's how sick I felt. And I never, and I'm a person that take vitamins and really try to stay up on the immune system, but I got so sick. But it also, what it did for me, it also helped me in this awareness to understand that as much as I want to get back in the sanctuary, that you don't want to endanger anyone by any means or any chance. And that's why this Zoom that we have, I thank God for it, that he has made that available, that we could still fellowship. And so I just wanted to ask you, like, what's your take on like church gatherings as well?
So again, I would say to remain from any gathering. I mean, even if it's a gathering of 3 to 4 people, you don't know. So you're walking around blind because you don't even know if this virus is next to you, to the next person. It's like for instance, it's 4 of us in the room and we all was negative. But then in 7 days, somebody started developing symptoms. But then you don't even know when you got it, right? Because you could have got it from your husband, or you could have got it from going to the store. So you don't know when this virus actually, affected you. So I would say remain from any gathering. Unfortunately, 2020 is not the year. This is not the year to take no more chances. And we really need to sit down, reflect, pray, fast. If we need to continue doing the Zoom, to me, I feel like it's the most safest way. Let's see what 2021 brings to us. But I think we've been doing fine with the Zoom. And that's it. I don't think we should do I personally, no type of gathering. I think no type of, even for me, at one point, I was thinking about, bringing my son to school. Like I was like, oh, I'm ready for kids to go back to school. But then look at the numbers on the daily rate. It's like, oh my God, this is so ridiculous. So I'm like, you know what? Like, unfortunately, if as long, the school provides those, those CDC guidelines where they do the social distance, the face shield, all that stuff, making sure that everybody's kept safe and healthy, then, I would want my son to go back to school. But right now, I'm kind of scared for my son to even physically go to school. So I would say, Apostle, no, that's just my personal opinion, to protect yourself and everybody in there. Because again, you don't know, some people are, are negligent. Some people be like, oh, I don't have it, and then walk around, have one love, the mask is out, is not, and then the crazy thing about it, where I see people does is they just cover here. No, you need to cover all of this, right? Not this, the whole nose and mouth, right? So I don't think you're going to be babysitting anybody at the church, Apostle, right? So, so I would say,
I was thinking, whenever we was to go back, I don't have no date with all these numbers, but I do have things in place, that I'm not depending on just people bringing their masks. We have masks, we have gloves, we have sanitizers, we have the temperature gun, we have things to be in place for whenever. But in the meantime, I'm just praying that these numbers could go down, and I was even asking the Lord when it was raining so hard that maybe you can do a washing of this COVID. And like you mentioned, I want to say real quick, when you mentioned about the surface, because that really, for some reason, sticks with my mind about opening doors and going in stores and touching, the iron bar, the iron doors, and, the metal on the handles. And so that's why I was saying, what I try to do is wear my gloves and then also keep sanitizing my hand. And I think I did get lax at one point. I really did with the gloves. And especially you have to do it with the gas, when you pumping gas and all of that.
For the gas, I'm like, but the only reason why I don't like about the store, because unless you're gonna have like a whole box of gloves on you, and you're gonna be like changing them every second, But as soon as you have the gloves and you touch that surface, right? And then what, you go into the produce, you're touching the bread, you're touching that, you're like, oh, so you done contaminated everything that you, because remember, from the door handle, from the cart, I'd rather I touch it, or I get like a little bleach wipe, and then I'm constantly alcohol, washing my hands versus walking around the whole time in the store with the same glove, and then somebody to call, you done contaminated your phone, you get the keys, you done contaminated. So it's like, I think it's worse you wear the gloves, unless you have like 10 pairs, and for everything that you touch, you change in between hand sanitizer or use an alcohol spray. But the same glove, from the time that you left your car to through the whole store, you done contaminated everything. And this is where I see people where I'm like, that's the same glove that you done use to open the door, to use the cart, to touch the fruits. And now what I do is I get the little plastic bags, because even with my bare hands, I don't trust it. So I get the plastic bags, and then if I get like some apples, I get like a plastic bag and I pick it up like that and then put it into a different bag. But with my bare hands, no fruits, like in vegetables, I don't touch with my fingers. Like I say, I constantly wash my hands, but I feel like you contaminate more when you wear the gloves.
Okay.
So if you're gonna do church like that, it has to be very small gathering, like space the chairs and like under 15 people. And that's already, again, the church, anything that's in the confined space, closed space, if somebody, that one person sneezes, like, oh, you don't know how far that droplet will, transmit. So I think it's just more, if you're gonna do it, strategize where, it's a one way, like most places, one way in, one way out, exit, doorless, doorless or something. And then, you just have to constantly have, the temperature thing. I when I think about it, that's just a measure that CDC, say, but everybody, not everybody walk around with a fever. Some people that's what I'm saying. Some people walk around asymptomatic and just have a dry cough for a whole time. Or some people just, oh my God, I have diarrhea, but never develop fever. So it's to really, it's kind of like, just, if you really just strategizing and implementing measures, that's the only thing. But
time comes. When the time comes, because it's not right now.
Okay.
So I agree. Thank you, Marisela.
Okay.
Marisela, you're muted. Do we have anybody else who have any questions or comments that's on the line on the phone? If you press *6 to unmute yourself and mute yourself, or *9 to raise your hand to ask a question.
Well, just before I go, I just wanted to tell my sister, congratulations. You did a wonderful presentation. Very informative.
Oh, thank you.
I'm very proud of you, and continue to bless this community with your words of wisdom and protecting us.
You're
both
welcome.
in the physical and in the spiritual realm. Thank you.
Thank you.
Love you.
Love you too.
And thank you, Apostle.
God bless you, Marissa. Good to see you. And I concur. I know everybody was truly informed even more tonight. Thank you so much. And so we just thank God. I don't know if there's any more questions. Thank you, Marisela. If not, we want to put it back in the hands of Elder Ahmad. If not, but this was such a true blessing. And we did record it as well on tonight.
Oh, thank you.
I have a question. I have a question.
Katrina. Okay, go ahead, Katrina.
Yes. Currently, I was exposed to COVID like it was last week, Wednesday. I still have no symptoms at all. I'm walking around fine, but I didn't know at that time when I went to my grandmother's house that the whole household was infected. And now my grandmother is currently at the hospital on a ventilator, and half of my household is in ICU. The other half is home. I'm home. I am quarantined, but I bring it back home to my family. No one in my household has no symptoms at all. I want to know will I be fine by day 9? Day 9 or day 10, one of those two.
So your question is, if you're gonna be fine, you're saying?
Well, right now I currently have no symptoms, but my grandmother's in the hospital. She's on the ventilator. Half of the family's on oxygen, the other half is home.
Jesus.
So the family
Right.
members that are in the hospital, they have other underlying conditions?
My grandmother, she's 77 years old. My cousin, she's overweight. She's obese. My uncle, he's has a trachea in his throat. They was trying to get him the ventilator, but they could not give it to him, push it down because of the scar tissue.
Wow.
So right now, when I spoke to him today, like, and not even an hour ago, he sounds fine. But my other two family members, no one can talk to them because they sedated on the ventilator.
So to answer your question, as far as you're gonna be okay, I mean, the good thing is you have no symptoms, but you're still not, I think you need to stay quarantined. You don't need to come out the house, even if you're feeling okay. Unless
Right. I mean, I don't let no one come over my house. The people that was coming to my house, I told them, I said, listen, don't come over. I want to stay quarantined because just in case I do carry it, I may be asymptomatic and don't know I have it and pass it along to you, which you may end up getting sick. And I don't want that on my conscience.
Right. So that's what I'm saying. I would say to continue to keep yourself in quarantine, and then maybe within the 14 days have already
Are you taking it?
Then retest yourself. But
I didn't get tested yet. I mean, I have no symptoms, no nothing at this current present time.
So how you know you got it? Because based on everybody,
because everyone that got hospitalized, they got tested and they became positive.
Okay, so you didn't get tested because you're scared to get tested, or
I didn't get tested yet because I didn't have the symptoms. Because the whole household got to get tested, and these lines are long. So
I have
So I know that's what I'm saying. You have to I would say, just to be on the safer side, and everybody around you in your household, is to get tested. There are different places. Try to see if you can go to some urgent cares, or somewhere where you can make an appointment, versus these long lines. So I was saying to keep your household safe and everybody around your household, because like I said, if nobody in your household have no symptoms, but if they go to the next person's house or they go to somebody else's house, who knows they have it because nobody got tested. So I would say that everybody needs to get tested, and if it, and once you find out your results, if you are negative, still take the precautions of wearing the face mask, and practicing social distance. So, I mean, I'm so sorry that your family members are in the hospital, but these are the measures that I told you, and I don't know if you came on the beginning of the presentation where I said the risk factors. So if you are 65 and above, you're already in a vulnerable population. If you're diabetic, hypertension, you have a history of a stroke, you have lung disease, if you're a smoker, if you're obese, overweight, this virus can really eradicate into your system like pretty fast, because it's like, oh, these are, and based on the criteria they make, it's just like when they notice the amount of people that have come to the hospital, the amount of people that have died, these are the categories that they feel like, oh, this person had an underlying condition, this person had hypertension, this person was diabetes. So don't feel like, oh, you don't have symptoms, you can't contract it, or you can affect the next person. So I would say to get tested, see if you can catch an appointment, maybe at a local community center or urgent care. If you have a primary office, and if they're doing testing, see where you can get tested and make an appointment. But definitely, I'm gonna keep your family in your prayers, and I pray that you are negative and everybody in your household stay negative too. Okay.
Okay.
I have a comment because I had it. So I would definitely suggest everybody get tested in your household just to know where you stand. From what I know, all insurances are covering COVID. So if you call your doctor, they might not test you in a doctor's office, but they'll write a prescription for you and you can go and get tested. Also, a lot of people were telling me do like natural and immunity boosters, like elderberry syrup is
Right.
really good.
And
Sea
that's
moss,
what I
yeah,
do. I do that on a daily basis. Even before the COVID and everything, I was doing that on a daily basis. I make my children make sure they take vitamin C, and I just bought the elderberry, and I take immune support builder. So that's why I was like, oh my God, and right now, since I've been exposed, I'm like very precautious. I'm like really on top of all my vitamins right now.
Right.
I'm not playing. I have a small daughter that depends on me, and I have my whole household. If anything happens to me, my whole household will fall apart.
All of that. Yeah, but definitely get tested. The insurance companies are paying for all COVID related testing.
Yeah, I have a friend. She's a nurse practitioner. She was going to do the testing for me. She just told me to come to her house and she'll test me.
Okay.
My mother was able to test me too.
Oh, that's
yeah.
So I guess, like I said, to take if anybody grasps from this presentation, like I said, educate your family members. Make sure that everybody take the same precautions. You know, I don't want family to be like, oh, I don't have it, and you coming here with a mask. Oh, take that mask. We protecting you and me. You know, and this is how we need to start practicing, you guys. We really need to take that precautions very seriously, because again, you don't know if it's gonna you the next person, or your loved one maybe the next person. And you see, as you guys can hear, her family members in the hospital, and again on the ventilator. And I just pray she can get out of this ventilator, because you have like that small percentage to make it from that ventilator, because it's a machine to help you breathe, but your body has to fight it back and say, okay, you know, my lungs is ready to be on its own, to breathe on its own. So, okay. Thank you.
You're welcome. But the thing is this, before they found out that everybody was tested positive for COVID, they put them automatically on the ventilator.
Because they must have came in with the symptoms of when they did their vital sign and their oxygen level already was not sustaining. On a normal breathing,
right.
when you put yourself in the machine, like they check it's like a little check either on your finger,
Yep.
or whatever, and they check and you the room air naturally you're supposed to breathe. They call it like the SpO2. You're supposed to breathe like 95 and above. If you come in, the first thing you come in and you're at 80, you're already at 90%. You're like, oh my God, the patient's already going to respiratory failure. And if you already come in at 70%, remember, you're supposed to breathe at 95 and above. If you come in the hospital with shortness of breath, and your oxygen level is 75%, they're like, oh, they're gonna quickly put you on an intubator, because it's like we're scared that this person's airway is gonna close on us, and that's what they does. They put like a tube down your throat to keep your lungs and your airway open, because they don't waste time and say let's test them first and then put them on an intubator. They look at the clinical the physicalness of right now. They're like, oh my God, look at the presentation of this patient. The patient come in lethargic, confused, their vital signs, their blood pressure is low, their oxygen is low. Let's save their life, and then we will go ahead and test them. But that's what they do sometimes. It depends how severely they come into the hospital, and to save your life, they just go ahead and put you on a ventilator.
Okay.
Yeah.
Thank you, Marisela. Any more questions before we get ready to close? You did an awesome job. I'm telling you, God is so good. I know people see you now in a different light. They did not know what was in you, but this is you. God knows.
Thank
God knows, and he knows how to bring us to the forefront when it's our time and our season. And right now, you're walking in your time, you're walking in your season. Know that you're going on another level after this Zoom. You're on a different level. You can't go back. You just go forward because you are blessed. And I'm telling you, you blessed us tonight. And I thank everyone who came on and gave questions and shared their stories. And I just thank God for this Zoom tonight. We was really praying that the Holy Spirit have his way. And I'm telling you, really educated us tonight about COVID, about how to take care of ourselves. I mean, you got in depth. You might not be the doctor, but you brought a presentation like a doctor. So I'm looking for more in the future. We might need you back in the next 2 months just to update us with where we are, because we can't just let this go. We need you back in 2 more months. You let me know your date and your time, because this is awesome. And we want to bring more people in and let them hear you, because the information you gave tonight, we wouldn't have learned this watching TV. We wouldn't have heard this. We wouldn't have got the knowledge that you gave tonight. So I just want to thank God for you and bless you and your family and your little children. I just thank God, you know, with all that you have on you, that you still took time to be here for us tonight.
Thank you.
Thank you so much. God bless you. And thank you, Apostle, for opening the doors where we can have this platform for our youth, which always turn out to be more of the adults than the youth. But still, if the parents get educated, we can educate our children. So this is still good. And we thank you so much. God bless you. Thank you. We getting ready to close. I just want to say, if anyone on here tonight does not know the Lord as their personal Savior, this is the time to give your life over to Christ, because you don't know the day nor the hour that God is going to come.